Good morning and welcome to the March Monthly Therapy Teleconference. I'm Beth Weldon, the Senior Regional Therapy Director for the Beltway Division of LHC Group. And we have a lot of things to cover today, so we're going to go ahead and get started. First, I want to take a minute to briefly talk about plan of care development. The expectation from CMS is that we as therapists use our professional clinical judgment and our knowledge to develop an individualized plan of care for each of our patients. Now, not only does that include goals and interventions, but it also includes frequency and duration. We should always use our clinical reasoning to determine the amount of therapy that we as professionals think that patient is going to need to achieve their goals, and we need to look at that 60-day period. So within that 60-day period, how much time do we think it's going to take to achieve those goals? It can vary anywhere from 2 weeks, 5 weeks, 6 weeks, all the way up to the full 9-week cert, just depending on that patient's presentation and their problems. It was never the intention of CMS for us just to write our goals for the first 30 days to get us up to that reassessment, and then do the reassessment and send the orders. Now, certainly if we think that patient is going to meet their goals using our clinical judgment within the 30-day period, that time frame is appropriate. But what we're seeing in many instances is that therapists are getting in the habit of just writing goals or just writing their orders to get them up to that 30-day period and then reassessing and extending beyond that time. Again, that was never the intention from CMS for the 30-day reassessment time frame. They expect us to write our goals and our frequency and duration for that time that we feel is appropriate during that 60-day period. And then we reassess at 30 days, and we reassess our plan of care effectiveness, and we reassess our goals, and we see what we need to do at that point. So again, it's expected that you use your best clinical judgment to establish that time frame on the front end, not just writing to that 30-day mark and then continuing past then. The next item kind of goes hand in hand with what we're discussing, setting appropriate time frames for each of your goals. You should set the time frame that you realistically expect to accomplish each individual goal. Now, at times, all of your time frames may be the same, if that's truly the expectation that you have for when each goal will be met. However, other times we should see that your goals have different endpoints as appropriate. If you write your orders for 6 weeks, I would not expect to see some goal. I would expect to see some goals for 6 weeks. In other words, not all ending in 4 weeks, or them not going 8 or 9 weeks. So what I've seen with some Joint Commission surveys this past year is that therapists would write 2 weeks 4, but then set a goal for 6 weeks. That's not appropriate. Or write 2 weeks 6, and all their goals end in 4 weeks. So your goals, some of your goals need to end at the time that your orders end. It certainly doesn't make sense for it to fall any other way. You need to use your professional judgment to set your goal time frames. So if you have a therapy-only patient, think about those goals that are related to our process measures, like the oxygen safety, the diabetic foot care. Certainly, if most of your functional goals are going to take 9 weeks, you might not truly expect that it would take 9 weeks for your patient to understand the oxygen safety. So we're seeing a lot of things come back from our PI partners questioning those time frames. So you really need to take a good hard look and be realistic with your goal setting and use the time frame that you feel is appropriate for each and every goal. I also want to take a minute to remind you that OASIS-D encourages the collaboration of our healthcare professionals to complete parts of the OASIS. Now, it's still the clinician completing the OASIS responsibility, but we are really encouraged to collaborate to make sure that we're painting the best picture we can of that patient and that we're most accurately scoring the items on the OASIS. Many of the GG items and the 1,800 functional OASIS items now go to determining the risk adjustment. So it's imperative that we collaborate and we make sure that we have that accurate scoring. So if you're not familiar with what risk adjustment is, that's an adjustment made to your outcome scores by comparing your patient's characteristics to the national average. So it's very, very important that we capture appropriately that patient's presentation, not only at start of care and resumption of care, but at discharge as well. So we need to make sure that we're having a great collaborative effort to determine the appropriate scoring for our patients. Next, I'd like to remind you about the relatively newly formed Therapy PR Committee. This committee works to recognize individual therapists that have done something worthy of a spotlight, and it also works to also recognize agencies that might have done something really great, that's gone out on a limb and maybe done a great job marketing a program or done something really special for the needs of the community. If you're interested in working on this committee, it just meets once a month. It's by telephone, and it only lasts about 30 minutes. It's a really small time commitment for a really great cause and a great way to get involved in the company. So if you want to submit a story about one of your peers or about your agency, you're going to send the story to therapy@lhcgroup.com. Again, send those stories in, and anybody can send in a story, and they are looked at by the committee monthly. So that's therapy@lhcgroup.com. We're still looking for members of this committee, so if you're interested, you can reach out to James Berg. That's James, James, .Berg, B-E-R-G, @lhcgroup.com, or just reach out to your regional therapy director. I also want to take a minute to encourage you to head on over to the LHC Group Facebook page and give it a like. And make sure to watch for those great stories, because that's where we're doing a lot of social media focus on some of the great things that are happening in LHC Group. So like the page and watch for those stories. And when you see something really good that you like on the page, share it. And that gets a lot of people more knowledgeable about what's going on within our company and recognizing our great therapists out there. I want to talk to you just a minute about something new that's on iTrain, and it is the therapy e-binders. So this is something new and exciting to get us all on the same page with our therapy program. So there's a e-binder for all of our clinical therapy programs, our ALF program, our continence control program, low vision, customized orthopedics, and active life balance care. These binders on iTrain have everything you need to know about the programs from an agency perspective and from your sales partner perspective. So you can go to the binder. It gives you a direct link for you to be able to access all the information needed about that program, how you sign up for the courses, how you find the home exercise programs. It also gives your marketing team tips about how to go out and talk to referral sources about the program. It talks about what your agency needs to provide the program. Like, for instance, with the continence control program, we need the Roll for Control kits. It gives a link on how to order those. So there's a lot of great information in these therapy e-binders, and they're brand new. They just were released last week. Now, to find them, the best way is to go to the catalog page. So when you go to the home page, hit catalog. And in the upper left-hand corner, you'll see e-binders by role. It's pretty small. You have to look for it the first time you find it, but when you see it, you'll say, ah, there it is. And when you click on it, it opens a link to each of the different ones. Again, we have assisted living facility protocols. We have the continence control, low vision, customized orthopedics, and active life balance care. So have a look when you're in iTrain next time, and I think you'll really enjoy these therapy e-binders and your agencies as well. So maybe your executive director has questions about the program. All the questions can be answered there. We also get a lot of questions about our Outlook calendars on your documentation devices, on your tablets. So sometimes you'll get an invitation to a meeting, and you accept it, and then it goes away. So we get a lot of questions, and if you know how to do this, it's fine, but a lot of people will say, well, it went away, and I don't know how to find it now. I don't know how to call in for the meeting. Know that once you accept that, it goes to your Outlook calendar on your device, and the way to access that is to go to Tools. So find your Tools icon and go there, and your calendar will be on that. When you click on your calendar, all of your invitations to your meetings are there. So maybe your regional therapy director invited you to attend a call about documentation or about a continence control program, and you accepted that and it went away and you don't know how to get to it. Just go to Tools and click, and you'll be able to find that, and it'll make it much easier for you. I get at least a dozen questions about that a month, so just thought we would mention that. Our clinical tip this month has to do with swallowing exercise and strategies. So this is for our speech language pathologist friends, and it's good for all of us to know. According to ASHA, the primary goals of dysphagia intervention are to safely support adequate nutrition and hydration and return to safe and efficient oral intake. And that includes incorporating the patient's dietary preferences and consulting with the family members, caregivers, to ensure that the patient's daily living activities are being considered. Also, to determine the optimal feeding methods and techniques to maximize swallowing safety and feeding efficiency, to minimize the risk of pulmonary complications, to reduce patient and caregiver burden while maximizing the patient's quality of life, and to develop the treatment plans to improve safety and efficiency of the swallow. So there's a lot of good exercises that can be done for this, and I'm going to mention some of those exercises. I'm not going to go into how to do those, but with today's call notes on iTrain, we'll have a link to this handout that has all these different exercises, but some of those are the shaker exercise, parts 1 and 2. These exercises facilitate an increased opening of the upper esophageal sphincter through increased hyoid and laryngeal anterior and superior excursion. So those are the shaker exercises, and then there are 2 parts to those. The laryngeal elevation exercises, which improve hypolaryngeal movement and the upper esophageal opening. So those exercises are always also on there. There are the Mendelssohn maneuver, which improve hypolaryngeal movement and the upper esophageal opening. The supraglottic swallow for airway protection. The supraglottic swallow for airway protection. The effortful swallow and hard swallow, which increases the posterior tongue base movement to facilitate bolus clearance. And the Misako exercise for strengthening the base of the tongue and improving movement and strength of the posterior pharyngeal wall during the swallow. So a link to these exercises is going to be with the handouts on iTrain. And again, to access these, they'll be up in about a week. It takes a little bit of time to get these loaded, but you'll go to iTrain. You will go to catalog and scroll down to therapy, and you'll see the monthly call notes on there. And you can click and you can find each monthly call note. So if you happen to miss a call, you'll be able to find the recordings there as well as all the handouts. Last but not least, it's my privilege to announce the Therapist of the Month. So for physical therapy, the honor this month is going to go to Miss Kathy Fagan. Kathy is a physical therapist from our High Point Home Care in Gallatin, Tennessee. Occupational Therapist of the Month award goes to Ashley Richardson. Ashley is a CODA, and Ashley works at HMC Home Care in Savannah, Tennessee. And our Speech Therapist of the Month award goes to Miss Allison Prater, Speech Language Pathology from Medical Center Home Health in Jackson, Tennessee. All of these recipients had multiple nominations praising them for being valuable assets to their teams, and also for always going above and beyond for their agencies, for the patients, helping out their peers and their counterparts. So, again, it was a Tennessee sweep this month, but each and every one of these had multiple nominations. I do encourage you guys to nominate your peers. Everybody can nominate people for Therapist of the Month. So make sure that you look around at your peers that are doing a great job and make sure that you give them a nod and acknowledge something they've done out there. Not only does that go into consideration for Therapist of the Month, but then also that PR committee looks at those as well, because we can only recognize one member from each discipline monthly, but we get a lot of great stories. So the Therapy Spotlight stories that the PR committee is doing brings a lot of value to that and helps recognize some other individuals that are doing great things. I want to encourage you also to be on the lookout for the announcement of the 2018 Therapist of the Year. That announcement's coming out really soon. So what happens, you may not be aware, the winner of each month's Therapy of the Month are voted on by the regional and national therapy team each year, and one great therapist from each category. So a physical therapist or physical therapist assistant, an OT or a CODA, and a speech therapist receive the honor of being named LHC's National Therapist of the Year. So that's a great honor to receive that award out of all the great and wonderful clinicians we have. To receive that Therapist of the Year is really, really an honor. Those recipients are recognized at an annual awards ceremony during LHC's Leadership Summit, so that's great. And they also receive a trip to their discipline's national conference. So there's a lot of great things that come with being the National Therapist of the Year. So again, I encourage you to nominate your peers for Therapist of the Month, and then know that we recognize our therapists not only as Therapist of the Month, but also we recognize that one great therapist for being Therapist of the Year. So keep those nominations coming in. All righty, we covered a lot of information in a short time frame today. Thanks so much for joining. Make sure and mark your calendars now for next month's call, which is going to occur Tuesday, April the 2nd, and that's at 8 o'clock, 10 o'clock, and 5 o'clock, and that's in the Central Time Zone. So make sure that you're aware that you change that to your time zone, but it's at 8, 10, and 5 Central, and I hope you have a great rest of your day. Bye-bye.